Hi, today I'm going to speak with you about diabetes. Diabetes affects millions of Americans every year. Thousands more are newly diagnosed every day. When a person becomes newly diagnosed with diabetes, they usually become frightened and depressed, mostly because they don't know anything about it. And what they do hear are about the complications that go along with it. Complications are very common, even with those who do control their diabetes, but more so with those who do not. Those are what we call non-compliant patients. They don't follow any exercise or diet regimen. They don't take their medication. They don't check their blood sugars. They have no idea what is going on with their blood sugar, and that can be very deadly if left uncontrolled. Your doctor can diagnose diabetes with a routine annual exam every year along with blood work. This blood work will let them know if your blood sugars are in normal range. Normal range is 70 to 99. 100 to 125 is called pre-diabetes, normally able to be controlled with diet and exercise. Anything from 126 and above would be considered diabetes, and that is something that has to be controlled with exercise and diet if necessary. Diabetes has several symptoms. One of the most common symptoms is neuropathy. Neuropathy is damage done to your nerves, normally in the lower limbs of the extremities. That's why you hear about people losing their limbs to amputation. Causes tingling, burning sensation, loss of feeling. Some people can't stand to have their legs or their feet touched because the neuropathy has destroyed their nerve endings to such a point that the pain is unbearable. Diabetes can also have you develop low blood pressure, can cause dizziness, irregular heartbeats, it can cause you to be constipated, it can cause diarrhea, it can cause nausea and vomiting, edema. Some people get extreme right upper quadrant pain from the diabetes. That's usually because the pancreas is inflamed. Men can develop erectile dysfunction because of diabetes. Women can develop vaginal infections, yeast infections, bacterial infections due to diabetes. You can also develop what you think is a urinary tract infection because of diabetes, only because your blood sugars are so high it has nowhere to go. It pours over into your urine, causing your urine to basically turn into syrup. And when you urinate, it can cause burning, itching, just a horrible feeling, so you swear that you have a urinary tract infection when you indeed do not. Diabetes can be controlled and checked every day. I do have a diabetes monitor here that we do give to our patients at work. I have not been fasting today. I have been consuming lots of sugar just to see where I would be at. They usually come with the reader, some test strips, a lancet. You have to supply your own alcohol tabs. And the good thing to do is to clean that fingertip off really good. Dry off the alcohol by air. Don't wipe it with anything. And you get your lancet ready to poke. You're going to poke your finger. It does sting. I would lie if I said it didn't. You want to squeeze the blood. And these will let you know if you've got enough blood in the test strip. It will make a noise. And it has enough blood. It is going to read it there and let you know what my blood sugar is. 149. And I just had another sip of coffee with sugar in it. Blood sugars can range. If I were to stop drinking my coffee with sugar in it, I am sure that it would go down. Diabetes, there are several types of diabetes. There's a type 1 diabetes. The person with type 1 diabetes usually has to have insulin. This is an insulin type diabetic. Their pancreas literally stops producing any insulin whatsoever. That's usually caused from some type of viral illness. Some people, again, depending on family history, are prone to having diabetes. But if you're a type 1 diabetic, you definitely will need to be controlled with insulin because your body's not making any and you need insulin in your diet. There's also a type 2 diabetes, which is very common with people with brown skin, again with a family history of it, people who have very low physical activity, people who are overweight, people who have high-calorie diets, lots of fat, and people who just, are kind of out of shape. Type 2 diabetics do not necessarily have to have medication. It can be controlled with diet and exercise. However, if a diet and exercise plan do not prove valuable, then medication is needed to help lower your blood sugars. There's also something called gestational diabetes, which is very common in women. They develop diabetes during pregnancy. This can be harmful to the mother and baby. It can cause the baby to be born premature, which can lead to a whole other line of complications. Some mothers do become insulin dependent while they are pregnant. Usually the diabetes is over with once the baby's born, within weeks. Some women develop full-blown diabetes even after the baby is born and must continue on with their insulin. Then there is also the pre-diabetes, which I spoke of. Blood sugar is usually at a normal high, which is 125, but as you can see, this is telling me I'm a diabetic today. I've had massive pop in my diet. But the whole key is diet, exercise, lower your sugar intake. You need to stay well. You need to have health checks every year. You need to eat healthy. You need to exercise. You need to check your blood sugars on a regular basis. You need to keep taking your medications, keep those appointments, follow up with whatever it is that your doctor told you to do. Comply with what your doctor tells you. They do know what they're talking about. They go to school for many years to learn this. You need to check your blood sugars for sure daily if you are a diabetic. You need to do skin checks every day to make sure no neuropathy has set in and you've got some infection in some lower limbs of your body. And you need to keep those yearly exams to keep your blood sugar under control. All of the information that I've just told you about can be reviewed on stormontbell.org or through the Medical Assistance Textbook, Volume 4. I hope you all stay healthy. Thank you.